Okay. Okay, here we are.
Wonderful. So as far as aging in place, support systems to remain in your home, you've got a lot of different options. Specifically what I'm going to talk about today is non-medical care services. So that's when not covered through Medicare. It's not something that was ordered by your doctor. It is specifically services that you can pay for and have in your own home to help you stay there. Everybody's care, we start with companion care. Everything is personalized to fit each client's needs. With that, comes many different types of services to help you stay at home, things that you might not know you need help with or aren't interested in doing anymore, planning or preparing meals. That's one of the big things to stay healthy, stay safe. You have to make sure that you're still eating, checking to make sure that food in your refrigerator isn't gone expired. I mean, I know that I'm guilty of it. I find food in my own refrigerator that needs to go. So just some of those things that, you could, I would love for somebody to make me a meal, but, so those are just some of the things that we can do. Food expiration dates, we can help make and change beds, linens. It is tricky. It's tricky to get those corners onto your mattress. Doing different light housekeeping, dusting, vacuuming, tops. For us, sort of where we draw the line is getting down on all hands and knees, doing windows, climbing ladders. That's a little bit out of the scope of practice. But, if that's something that you need, there are other resources, different specific cleaning companies that can do a deep clean. We can offer you those resources to find what your needs are. Different things that's, more companion care, non-ADL skilled personal cares, doing laundry, ironing, taking out your garbage. If you need help running errands, maybe you don't feel comfortable driving anymore, you don't drive anymore, but you need to get out and you still need to get those errands, get to the store, doctor's appointments. Those are all different things that non-medical home care services can help you with. We can also help maintain calendars, keep you organized, and then simply spend some time. Sometimes you just need someone to speak with, somebody to be there with you. When we then talk a little bit further as far as if you have had a change, we do offer personal cares. So we help with bathing, dressing. Sometimes it becomes a challenge depending on what your bathroom setup is, getting in and out of the tub. If you have a tub, but you have a shower bench, sometimes it's hard to get your legs up and over. So sometimes what we see as far as bathing, sometimes folks just want somebody to be there in the home, just sort of a peace of mind, a safety thing. So then you can still do as much for yourself as possible, but that there. Okay. We can also help with different incontinence cares, personal cares, like I said, positioning, transfers. Everybody's needs are different. So these lists that we have shown, it's not all inclusive. Okay. It's just kind of a broad idea. We come up with care plans. So we have a case manager come out and meet the person or their family and put together a care plan. Everything we do, care plans are like breathing, living creatures, right? We're humans, everything changes. So we support and make those changes with you. With that, I think it's important to say that non-medical home care, there is a licensure piece there. So I don't know if it's possible to switch to the next slide. Yeah. So, certain things that would be considered skilled care. Now, this is going to vary from agency to agency. So it's always good to ask, no matter who you're talking to, if there's any limitations or certain services that they're not able to provide. Because like I said, there is a licensure piece to it as far as if things get a little bit too skilled. Okay. So skilled care would be any sort of wound care, injections, that is out of the scope of practice for non-medical home care. A lot of times there would be lifting restrictions. We can help you organize, sort through different things, but there might be lifting restrictions that we can't lift over 35 or 50 pounds. Climbing on ladders, massages, certain like a hand massage or foot massage might be okay, but full on massages, again, kind of out of the scope. So medications is always a tricky one. You definitely want to ask whatever non-medical home care agency you're talking to what their rules are for managing medications. Can they simply do reminders, or are they able to package your medications into a pill box? What are their rules for that? Because every place is going to be just a little bit different. There are a lot of different ways. Medications can be one of those ways if people are struggling to maintain their medications in the home, maybe not taking them on time, forgetting. If you have a lot of different medication changes, that is one large way that folks actually end up being admitted to the hospital. It's not their medications not being taken as prescribed. So certainly if that's something that could help you remain safe in your home, definitely having some support with your medications. Sort of a tricky one that doesn't always make a whole lot of sense, but nail trimming, hair cutting. I don't know that you would want somebody not trained in cutting hair to cut your hair anyway, but nail trimming, certainly. If somebody has diabetes, we do not want caregivers to be clipping fingernails. Again, every agency is going to be different. But if we nicked your skin, that could cause more significant problems. So if you needed to see a podiatrist, again, you know what, we can help get those referrals, help you find the support that you need. Medical emergencies, that's another big one where our staff wouldn't provide the life-saving measures. We would call 911. So really knowing what your agency, whatever non-medical home care agency you work with, asking some of these limitations as far as what they're able to do, not able to do. Okay. Can we switch to the next one? Thank you.
I could jump in there, Becky, real quick. How do you decide on this list? I mean, some of these things are obviously regulated activities, right? But
yeah,
others are just a pain in the back, like lawn mowing. That's a lot of work.
It is a lot.
How do you decide?
Yeah, I mean, that's something that we just as senior helpers, we just don't do. That is going to be out of our scope. And so that's a great question, Mike. And, senior helpers is only one of, I think we're over 40 non-medical home care agencies available to folks in the Dane County area, which is wonderful. But everyone is going to be just a little bit different. So, deciding on what we're able to do and what we're not able to do, every agency is going to have their own policies and procedures for it. So, I think most of them will be as far as the medications, what they can do that would fall under getting into towards skilled care, injections, things like that. Most of them aren't going to be able to do that. They may have slightly different policies. Even our policies change a little bit as far as medications and how we're able to assist in getting their medications if somebody starts hospice. you know, that changes our ability to do a little bit more for helping folks with medications.
Becky, I have a question too. You say there are about 40 groups doing this in the area. Is there a list anywhere that we could refer to see who is providing these services?
Yeah, the ADRC will have your most comprehensive list, and I'm happy to reach out to them and see if we can get that full list. We may have it on the website, or I can, like I said, I can see if I can get that comprehensive list for you.
Well, I wonder if you could get it to Mike and he could send it out. I don't know, Mike, maybe this is not possible either, but
I
could
can
you
do
send it
that.
out?
Go ahead. Becky,
you
if you get that later, send it to me and I'll distribute it.
Absolutely, that would be great.
Great. Thanks,
Yes.
guys.
Yeah.
Jenny?
If I could comment on the lawn mowing issue. I think what Becky's talking about, and my experience as a retired nurse, has been in personal care. A lot of people who live in their own home hire someone to mow their lawn. It's got nothing to do with their longevity, health, or well-being. So I think that's one way to take a snapshot of what Becky was presenting to us today. Yes, no?
Yes, very correct. Yeah,
Thank you.
welcome. So yeah, you know, I think.
Can I ask one more question? This is Jane. On the previous slide, there was something to the side that said that you could refer like some nursing help or some, I've forgotten the two things. You didn't talk about that. Nursing services and senior healthcare management services, that one. On that side, you didn't mention that. Optional services.
On this one, by client.
Yes. Does that mean that your agency could provide that from another agency or from your agency?
So the optional services requested by client as far as senior helpers goes,
Yes.
case management that is above and beyond what we already provide. So if you needed somebody to go with your loved one or with you to a medical appointment because all of your family is out of town, if you needed sort of that next step up where you needed a case manager to help sort of facilitate communication between medical providers, family, continuity of care, then that would be an additional service on top of what our caregivers provide.
But could your caregivers take someone to an appointment if they're independent?
Absolutely. Even if they're not independent, you know, they can still, it would just be if there needed to be more, you know,
More of a medical person there.
correct.
Okay.
Yeah,
Okay, thank you.
you're welcome. And then the nursing piece would be, we do have an RN on staff that would be able to fill the med box. Our normal caregivers would not be able to do that because that's considered dosing. So our RN would be able to, but that's an additional separate fee. And a lot of times, you know, it would just be more cost effective, if cost is an issue, to go through a different pharmacy that can package the med box for you. So we talked through those issues, what people's needs are, what sort of support that they need as far as would this qualify for a nursing med box fill or not. There is still limitation with that because we are still not, so even though we have an RN, we are still not licensed to be medical. Okay, so we still technically would not be able to provide skilled nursing care. We wouldn't be able to do the skilled nursing care, like wound care, injections. So it gets a little tricky, but you know, we can help folks find what they need. Okay. Any other questions on that?
I just wanted to comment. I think it's important for the group to just know the difference between supportive home care and home health. without going into it too far, but I think that would kind of explain some of what's being asked. You know, home health being skilled services, nursing, physical therapy, occupational therapy, speech therapy, you know, those services that tend to be more temporary for most people and are related to transitions, but maybe they're more long-term as it relates to needing a nurse coming to check on a chronic condition or but that is another tier within the home health world or supportive home care world. And so when you hear home health, that really should mean more skilled services. And when you hear supportive home care, that's more of the supportive everyday lifestyle services. So I hope that helps, and we won't expand upon it too far because we weren't really talking about that home health component today, but there definitely are services that are specific to that need that complement supportive home care services and other services very well. I mean, we have home health providers that come into our community here. So just so you're aware.
Well said, Heidi. Well said. So continuing to move forward as far as specialized care programs, you know, talk to your home care provider, your non-medical home care provider, to see, do they have any special trainings? Is there anything that should stand out for us specifically? We do have a Senior Gems program, which specifically is about dementia and Alzheimer's, working with folks at different stages. Pretty neat program. If anybody wants any information on that, or just look up Teepa Snow. She's got a very good approach to supporting folks, a lot of different family links as well on her website that can be very helpful. We do also have specific Parkinson's care training with senior helpers that everybody goes through. If we want to switch to the next one. So one of the other things that I just want to point out is that looking at your home and seeing if there's any other things in your home, is there something that can be easily changed to make your house more safe, to try to avoid an accident and to keep you home and supported in the environment you want to be. Doing a home safety assessment is a huge help in determining those safety factors. We do conduct a called life profile. A lot of times this is where, as Heidi was saying, your skilled home health folks would also conduct something like this. But it looks at many different safety risks, medical condition monitoring, independence. What are you able to do? What do you need help with? Where are different levels of things that can be adjusted? Quality of life, burden of care. Burden of care simply means, the level of help that you need, or is there a lack of help? So looking at all of those different things, different ways to keep you home safely. So I would say one of the biggest things is that there are so many options, like I was saying, for non-medical home care. It's not one size fits all. So it definitely, you do want to call around. I know it can be kind of tedious, but you definitely want to call around and ask the questions regarding their services, limitations, services that aren't included, always cost, what kind of insurance do you take? A lot of places, non-medical home care, although they don't accept Medicare, taking long-term care insurance is sometimes an option, or Medicaid. So really talking through what your needs are and finding what fits best. And we'll get that list to you. I will get that list for non-medical home care, and we'll get it sent out. Any other questions? That was pretty flyby.
I guess I have a question. What sort of training do the home health care, non-medical home care people have?
So that's going to vary company to company. I can have. We see caregivers that have been trained as CNAs. We have people that had a profession in something completely different. Now, when they come to us, everybody receives the same training, okay? Do hands-on skills training. And that's about a full day of skills training regarding personal cares. We do go over with our staff, you know, do you know how to make a meal? Do you know how to make a meatloaf? Can you follow a recipe? You know, asking those basic skills. And if they don't, then we, you know, try to support them in various ways individually if needed. But yes, definitely go through that skill training where we train on lifts, sit to stand lifts, Hoyer lifts, transfers in and out of tubs. We actually in our office have a little setup where we have like a fake bathtub shower here that we actually have everybody go through. They also, for us, to go through the GEMS training, the dementia training, and full day Parkinson's training as well. And then annually, they continue to have to go through the Parkinson's and GEMS training, the dementia training. And then, you know, sometimes when folks first come, you know, they may get training and using lift, but then they don't have a client that needs one. And eventually, you know, as folks progress, or maybe they get a new client that has a lift, well, we are always more than happy, you know, bring people back and let's get some hands-on training again before you go and do something that you're not comfortable with or don't feel you have the skills for. And some of our caregivers don't do personal skills or personal cares, and that's okay. We just make sure that when we match up clients and caregivers that we pay attention to those things.
Thank you.
Okay. I think I'm next, and so I'm Heidi. I'm here to talk about assisted living services and or memory care, and what that might mean for someone from a short-term stay. Certainly knowing that this service could be short-term or long-term. But assisted living is really a place where people can come and live a lifestyle of companions and being with other people, or just come for a short term, which we're going to talk about today, and really get some of those needs met while still having those social opportunities. And this could be used for many different reasons. Maybe it's a caregiver that needs a break because you're the primary caretaker, son, daughter, spouse, or otherwise, for somebody with dementia. And you need to go on vacation, or you have a surgery planned, or you need to just take a break and take care of yourself for a period of time. And I would say most of the time, minimally, the respite stays would be 2 weeks in assisted living. And I'm going to talk a little bit more about why that is, because there is a lot of transition that goes into making that happen. And then also, you know, a lot of locations now are going to more of a month. And so we'll talk a little bit more about why that is. And then, you know, there may be just those folks that maybe have gone through a rehab stay, recovering from a surgery or a fall or whatever it might be. And they've been in skilled nursing, and skilled nursing is saying, hey, you're not skilled enough anymore to continue on with our therapy here. So your services are going to have to come to an end, but maybe you don't have that strong support system at home. And you know that if you go home, it's going to be hard to do all the things that you need to do. And, you know, maybe home care, supportive home care is the option with home health, and maybe assisted living is a better option. But those are all things to be considered at that time.
Could I ask,
So-
are you with a facility?
I am with Brookdale Senior Living. Mhm. Yeah. So we are going to talk a little bit about Respite and, you know, more in depth about why you would consider it. respite services are very personalized to what your needs are. When you come into our community, whether you're staying long-term or short-term, you'll always have an assessment, and we'll always assign a care plan based on what your needs are that can change over time. So if you need more when you come and 2 weeks, 30 days down the road, you're still here because you still need a little more time to recover, or you need a little more of a break as a caregiver with your loved one, we can adjust those individual needs, and that would be consistent amongst all the personal care communities. Is the ability to adjust with you as your needs change. Assistance with activities of daily living. So Becky talked a lot about what those things might be. Things like dressing, bathing, rooming, toileting. In assisted living, I think the biggest difference, unless you're going to have a live-in caregiver, is that our hours with caregivers aren't scheduled. We always have caregivers in the community. Yes, it's not the one-on-one care that you would get with having a caregiver in your home, which is another benefit, but it is caregivers that are available to you 24 hours a day. So if you wake up at 2 o'clock in the morning and you need help going to the bathroom, that caregiver is going to be able to come assist you. If you have a pain medication that you're taking per your request, you can request that pain medication at 8 o'clock at night and somebody's going to bring it to you. So those are things to be considered. When you think of memory care, it is a safe and secured environment. So if you have a loved one at home that has a tendency to wander or that sort of thing, you may put some things in place for them. And so then you have to kind of consider, do you want to have an awake staff person at night, through home care, or do you want to maybe consider assisted living where there's going to be other people, there in the community, and they're going to have a secured environment where the doors are alarmed and that sort of thing. So I'm just kind of trying to compare a little bit what some of the decision-making might revolve around when considering, do I want to stay home and have the services, or do I want to go somewhere and have the services? And then there's always cost to be considered. So we have daily rates or monthly rates. Our monthly rates are divided by 30.5 to get a daily rate. If we're doing a shorter respite stay, and I'm sure it's similar at other places, there would be an upcharge because of the shortness of it, but still making it available to people. And then also providing a furnished unit. So making sure that we have furniture available that can be used so that you don't have to worry about trying to move everything and then move everything again. So those are things that can be offered at some places and not offered at others, but always good questions to ask if you're considering something like this. Financially, it's really going to vary. There are kind of guidelines, and if I was going to say respite and assisted living, I would say probably anywhere from $4,000 to $8,000 a month. If I was going to say respite in memory care, I would probably say anywhere from about 6 to 12. So there is a lot of variation in the cost, and those are specific questions that you would want to ask when you're looking into whatever location it is or locations that you're considering. And it's going to depend a lot on the individual care. So if yourself or your loved one has a lot of physical or cognitive care needs, that will increase the costs. If it's something lighter, where you just really need your meals, your laundry, your housekeeping, kind of those basic services that everyone gets when they come into a care community, then, your costs will be on the lower end. So those are, things to consider in relation to costs. The other thing is I always like to make people aware that there are 2 levels of assisted living in the state of Wisconsin. And one level is called an RCAC, and that's Residential Care Apartment Complex. And in many communities, this is an area of licensure within often an independent living community where certain apartments are licensed for them to be able to provide care and support. And they can provide up to 28 hours of care per week under that licensure. And it is a great opportunity, especially if you're that person that doesn't have a ton of care, wants the social lifestyle. They can certainly help out with recovery. They have very often rehab services, either in-house or home health can come in and provide rehab services, because assisted living is still considered a home setting as relates to Medicare, which is the payer source or any other insurance for that skilled home health. Okay. So our services as it relates to receiving therapy would be no different than if you were at home, in your own home. So those are things to be considered. We do have like many other locations, we have an on-site therapy gym. So that is available for the therapists who provide services here to use with the clients, as well as going into the apartments and using the other areas of the community for their recovery. When I transition back, CBRF, Community-Based Residential Facility. Again, that's Community-Based Residential Facility. And that is the second level of assisted living. Now, that doesn't mean you have to do an RCAC, then a CBRF. It just means that the licensure for a CBRF is different than that for assisted living. If you have an activated healthcare power of attorney, meaning that you've been deemed incompetent by a physician or physician and a psychiatrist, you can still move into a CBRF assisted living by law. You cannot move into an RCAC by law. You can also move into a CBRF and not have limitations on hours of care other than what the community itself feels they can or cannot provide. So the opportunity to utilize things like lifts and Hoyers and things like that can be a little bit greater in a CBRF as those needs transition. In any memory care community, unless it's an adult family home that's providing memory care, will be licensed as a CBRF. So if you're talking memory care, you already know it's CBRF. If you're talking assisted living, it could be RCAC or CBRF. And those are things that we can help you understand more. And each community, just like each home health agency, works around that a little bit different, or supportive home care agency. So those are specific questions that you'd really want to ask to the communities that you're visiting is, what if I have higher care needs? How does that impact me? So making the transition. So sometimes people use respite stays as a way to help themselves either have that experience to see if they like it before they get rid of their house and do all those things, or use it as an opportunity for a loved one to say, you know, is this going to work for us? And it gives them that opportunity to experience it without a long-term commitment. And even if you moved into an assisted living, most locations have a 30-day to 60-day notice at most. So you're never locked into a long-term plan. And I think that's really important for people to know. Because I do, having worked in this field for a long time, hear those, you know, apprehensive conversations or children coming to me saying, we really want mom and dad to get more help, but they're not willing to move out of their home. What do we do? We're worried about them. Can't sleep at night, knowing that they're, you know, may not be okay. And so we talk about these different options, and we talk about how do you have that conversation? And often a short-term or respite stay can be a great way to provide that experience. And of course, you know, making sure that when that happens, we're providing that safe, attentive, and caring environment where they have staff around the clock 24/7. And in our case, you know, we have 2 full-time RNs here. So we're very clinically orientated as well. Even though we're not a skilled nursing community, we do have people here that can assess and help with challenging situations, health changes, that sort of thing. And they're here primarily during the day, those two RNs, but they're also on call. And every community has different staffing for RN services, but they all have an RN associated with their community. So it's important to ask questions about what is that RN's involvement, how often are they present, and what would they truly do for me if I was to stay here for continued recovery, or if I was looking to do a respite with possible transition to long-term care. Any questions before I go on to the next?
I have a
Heidi, they were going
question.
to wait on questions until the end.
Oh, okay. Well, I just know there was some
If I
being
could
asked.
interrupt here because we're running a little short and I want to make sure we get in Marie.
Okay,
If
sounds
you
good.
could
Well,
just
I'm
hold
on
those.
to kind of a closing here, so I think we're
Oh,
good
okay,
on my
great,
part
Heidi.
then. If you want to hold off, yeah, no problem. So, I think we talked a lot about the different services. So I don't feel I need to talk too much specifically about this, but I just think these are some good things to ask about when you're considering a place. What is your dining like? We have restaurant style dining here. People get menu choices and options. What do you do? What is your meal like? Can I try a meal? Absolutely. Amenities. What does the community look like? Do you want something small and easy to get around, more like a home? Do you want something larger, apartment style? We have both options within our Brookdale communities in the Dane County area. But I feel like it's just important to know that those options exist, and you have so many choices, and there are great resources, and we can, I'm sure, might get a list of those resources as well. And then events and activities. What do you have going on every day? What's going to fill my cup? What's going to help me? For some people, that's really important. For other people, it's like, I just want to get better and get out of here. Either is okay. We'll help with whatever you need, but at least you'll be seeing some people each day. And living spaces. Everything from studios, which are more of a private room or suite, to 2-bedroom apartments are pretty standard within memory care and assisted living. And memory care is more of your studios usually, and maybe a 1-bedroom if you get lucky. There's a couple locations. So that's kind of what you're expecting, but there's definitely opportunities for couples within memory care that I think people should be aware of. And there's that opportunity for assisted living where you have a larger living space, still maintain a great lifestyle and often more active, but have that opportunity for care, have that opportunity to not make 3 meals a day, and just lighten the load, not have the upkeep of the house and that sort of thing. So those, I think, are some of the benefits to any community. And certainly, if you'd like to use me as a future resource, I'm happy to help. I will always steer you in a good and healthy direction. And I do think one thing we haven't talked about, and I'm not going to touch on it long because we're short on time here, but just planning. Respite stays do require some paperwork. You can't just come here. So we have to have a physician plan of care, which means you want to be sure that you're updated with your doctor's appointments. We have to have a test to rule out TB, which we can get fairly quickly with a visit to the doctor's office, a lab, that sort of thing. And we have to make sure that there's appropriate documentation in place, especially if we're considering someone who's incompetent. So that's your power of attorney paperwork. So those are 3 things that are always important. Keep up with your doctor's appointments, and make sure that you are talking to the community to find out what the requirements are for TB testing. And then also make sure that your POA, power of attorney documents, are in place and up to date, because that will help with any transition for respite into assisted living and just make that process more smoother and efficient. So thanks, everyone. We're moving on. And I don't see that.
Heidi, if you can unshare your screen, please.
Yep.
Thank you.
Sure.
Might be.
Okay.
Great. Thank you. Okay. Thank you, everyone. Thank you, Mike and Amber, for having me. And thank you, Heidi and Becky, for your presentations. I just want to say just ahead of time, I do have to leave right at 11. I apologize if we're not able to get through everything. I do have appointments scheduled. So, but I will try to be as efficient as possible without speed talking. So I'm going to try really hard on that one. All right. I'm Marie Severson. I am a speech language pathologist, and I am the owner of Madison Speech Therapy, which is an outpatient mobile speech therapy company. So we're the only speech therapy specialized mobile outpatient therapy company in our area. The reason I started this company was because I have worked in all different levels of care. I've worked in acute care, skilled nursing, inpatient rehab, home health, and now outpatient. And when I started working in home health, it became clear to me the differences in what we think patients and clients are going to be able to do versus what they actually do at home. What is realistic for people at home is very different than what we assume in the clinic spaces. So I just developed a passion for treating people in their homes because it's the most functional place for them. They are happy there. They want to stay there. And I found that it helps people stay in their homes longer because having that oversight of a skilled professional can help catch things that require referrals or safety adjustments in the home. Briefly about speech therapy, we can treat swallowing disorders, communication disorders, cognitive disorders, and then I also do mobile swallowing disorder testing. The types of clients that are typically seen by a speech therapist can include stroke, Parkinson's, dementia, including mild cognitive impairment, people who are interested in cognitive wellness programs, and then traumatic brain injury and concussion. So it's not limited to those conditions. It's any condition that impacts thinking, language, or swallowing. One of the features that we offer that supports aging in place is intensive programs in the home. So we have 2 intensive programs, including intensive swallowing disorder rehab and intensive comprehensive aphasia programs in the home. These programs are designed to improve skills beyond what traditional healthcare allows. So when we're talking about clinics, we're talking about travel time, we're talking about limited amounts of time, and despite clinicians' best efforts, it's not always as comprehensive or personalized as it can be. So I have the flexibility of creating programs that work for clients and saving them time and energy and money through doing this in their homes. I also do comprehensive Parkinson's support. So speech therapists often help people with Parkinson's maintain their skills throughout the course of a disease process like Parkinson's or dementia through comprehensive and proactive approaches to care. So specifically with Parkinson's, since we know there's a somewhat predictable pattern of change over time with some variation person to person. We can address the voice, language, cognitive, and swallowing issues before or when they are very minimal or minor so that they don't turn into significant issues, or we can plan for potential issues that could arise over time. For example, swallowing problems are commonly associated with negative outcomes for people with Parkinson's. So if we can assess and begin treating or at least become aware of whether or not there's an issue, we can hopefully prevent issues like malnutrition, dehydration, and things like aspiration pneumonia. So always proactive versus reactive. Typically when people are coming into clinics for therapy, it's a reactive approach. They have a problem, they talk to their doctor gives them a referral. We're trying to address something that's already become an issue. But in the cases of Parkinson's and dementia, I like to approach it differently, specifically because I think that leads, like I said, to better outcomes for people overall. People tend to get lost to follow up a lot when we're talking about the traditional healthcare model. So that is one of the benefits of the home-based outpatient. And then I do like to check in with my Parkinson's clients every 6 months. just to make sure that they're maintaining the skills that they've gained. And if they need any refreshers using, for example, a structured program like the Parkinson's Speak Out program, which is specifically for voice and speech, that we can go ahead and do a refresher before the voice or speaking issues become any worse. Another unique program is the Family Memory Navigation Services. So these services include anything at all, honestly, that could be related to cognition, communication, language, family dynamics, anything that encompasses the challenges that can occur when loving somebody with dementia. And so this includes caring for that person, but as well as their family members. So there are a lot of supports, like Becky was talking about, like their senior helpers can come in. There are a lot of ways to support people in their homes with dementia. My program is specific to the fact that having a skilled person who has a lot of training and expertise in this area, specifically with cognitive communication skills, can be very beneficial to assessing and treating some of the issues as they arise, especially in the milder parts of the disease process. So trying to address things as they come up early, like looking at the environment and identifying whether or not we need to adjust things like lighting, we need to adjust and implement reading magnifiers, lighting, things. I mean, that's very common. Maybe we need a referral to an eye doctor, audiologist. Those are also very common things that we need to be addressing so that people can get those issues resolved so that they don't make the condition worse. So I've had clients where they had a hearing issue, and once they got hearing aids, they had a significant reduction in some of their symptoms. But they wouldn't have thought to follow up with the audiologist had we not had that conversation and made that connection between hearing and communication and hearing and cognition. So, you know, with the memory navigation services, you're getting the expertise of a skilled therapist, and I'm not bound or, you know, constrained to anything that the traditional healthcare model typically constrains people in, because insurance only covers certain components of dementia care or care in general. So insurance covers, and I have a slide on this, some aspects of dementia care, but then it doesn't on some other ones. So it covers things like the cognitive screening and assessment, dementia staging and monitoring changes, but it doesn't cover things like family meeting, family trainings, you know, in-depth education, phone calls specifically talking about the person, developing a personalized care plan and training the caregivers. Like if, you know, if senior helpers is coming in, you know, training multiple caregivers, working with them. And then additionally, I can help by implementing a Montessori program for someone, which helps people participate in activities that are cognitively stimulating to help prevent things like confusion, disorientation, wandering, agitation, because people need activities to do. But one of the hallmarks of dementia is people tend to withdraw from social activities or familiar routines. So trying to reestablish routines that the person would actually be interested in doing, or helping them find value in it so that they're doing things that have a purpose throughout the day, is it's a well evidence-based approach, and it helps families out a lot too. So I can offer a hybrid approach to therapy where we combine insurance covered services with non-insurance covered services. And typically we're able to start out with insurance covered regardless of the stage. It's usually in the mild to moderate stages. And if people are more in the severe advanced stages of dementia, it might be more that family support services, focusing on how families can address, cope with, and support the person. Because ultimately with dementia, we're not really going to be changing the person. We're going to be changing our own approaches. And so that's where the education and the support comes in. So I developed this program because I felt like there was a significant lack of family support for people with dementia in the home environment. There's a lot of support. If you go to a clinic, if you go to the doctor, they can give you resources. We have wonderful community resources, but we don't have a lot of supports for how to implement that on a personal level there's a lot of information about what works, what doesn't work, what's helpful, what is dementia, what to expect. But I'm talking about something that's personalized and comprehensive, directly related to your loved one, yourself, and your family. And that has had, tremendous impact on families in my experience. Okay, so specifically talking about services that are covered or not. So insurance is generally going to cover speech therapy for acute illnesses, stroke, brain injury, speech therapy for chronic issues like Parkinson's and dementia to a certain degree. Insurance covers swallowing testing. It covers cognitive assessments related to dementia. It covers cognitive assessments for general concerns. So, excuse me. If somebody comes to me with a challenge and I don't know what it's directly related to, we can either do an assessment or I will recommend you have a referral to an appropriate provider. For example, I often refer people to the neuropsychology services or the geriatric memory care services through UW Health, because those professionals are specifically trained in identifying why somebody's having a cognitive or communication problem. So it's important to know why someone's having the issue before we work on treating it. And for a lot of people, they haven't been referred to the correct avenue to really get down to what is going on first. So I'll help with the referral process as well. But in terms of the private pay services, family memory navigation is not covered by insurance. Any types of specialized programming for therapy devices or creating complex or comprehensive types of materials for someone's environment, that's not covered by insurance. Cognitive wellness isn't covered, but it's wonderful. Some people really enjoy and benefit from cognitive wellness programs. Maintenance skills are technically covered by Medicare. However, the requirements to actually get that covered and reimbursed is a challenge. So that one's a little tricky. I think it's a little bit gray, but I think I feel very skilled in recognizing what would be appropriate for maintenance versus not, especially when we're talking about maintenance of cognitive skills related to Parkinson's or dementia. It's a little bit easier to justify Parkinson's sometimes versus dementia, but that's a little bit complex. So we can discuss it personally related to your situation. And then let's say you just want extra therapy. Sometimes people want more therapy than they're able to get through the traditional healthcare model or through what is considered reasonable by Medicare. Let's say somebody's like, I want 5 days a week. I want to do 5 days a week for 3 weeks. And I say, well, we did an assessment and Medicare, based on your assessment results, Medicare is not going to cover more than 2 or 3 days a week. You can pay for extra therapy. You can get extra therapy. This is something that's not typically offered because most clinics cannot accommodate large volumes of therapy because they don't have the availability of staff. So one of the benefits of choosing an independent provider or practitioner is that you have more flexibility to work with what you can, and they can work at the top of their license, and they can work at they can provide you with services with the breadth that is possible versus what is typically constrained if you work for other types of bigger medical companies, if that makes sense. So in terms of insurance participation, I am a Medicare Part B provider. I'm in network with the listed insurers here, but this is subject to the individual plan. And there may be costs associated with plans like deductibles, for example, or copays. Most of my Medicare clients don't pay anything, but some of them, their supplemental insurance doesn't have out-of-network benefits. So they do have a small copay for therapy. So it really is just dependent on your plan. I always check benefits for my clients because I like to know what to expect, and I like to be able to tell people what to expect. So I will check benefits as long as you have your number and the phone number for the insurance company. I will check them. It does not take me long. But I'm not in network with the other insurances listed here. Some of those plans might have out-of-network benefits, so we still might be able to work together, or you could choose a private pay option. So it's never a hard stop. There are limitations financially, of course, But if I cannot help you, I will refer you to someone that can. So I know all of the other speech therapists in our area. I know what the wait lists are like for other clinics. I know what clinics specialize in what. I'll make sure that I can help you get to where you need to go. And then just summarizing how my services work. Because I'm focused on comprehensive care, we can do insurance only, we can do private pay only, or we can do hybrid, where we start with insurance and then over time we transition to private pay. So this is all very individualized and based on your personal needs. But that is the benefit of having care and through an independent provider. And my services, I believe, help people with their goals of aging in place wherever they are. So if they're at home, if they're in assisted living, I want to help them stay where they're at as safely as possible by either providing them services directly or referring them to people who can help them in the community. Thank you.
Oh, sure. Terrific presentation, Marie. I'm wondering, we had one person ask, what kind, I mean, we seldom talk with the speech therapist. What kind of training does it involve? I mean, you're a highly specialized professional. How were you trained?
Yes, so it is a master's program required with a clinical fellowship after that of about 9 months to a year. And then our scope is very broad. I will say that I have been a speech pathologist for 6 years, and I have spent the entirety of that taking additional continuing education to specialize my skills in swallowing and swallowing disorders, Parkinson's care, dementia care, aphasia. I mean, every area of our field is so complex that it really does require somebody who wants to keep learning after they've gotten their diploma. So I would recommend that if you're looking for a speech therapist, ask them about their experience working with the kinds of conditions that you have. And specifically, most importantly, I think related to swallowing. Swallowing studies can be about a 2-month wait list in Madison right now. I can get people in for swallowing testing with fees in less than a week. And my reports are very thorough and detailed. And I focus a lot on what matters to the person for their quality of life, not just focusing on trying to adjust people's diets, really taking everything into consideration with hydration and nutrition. So the challenge and the beauty of speech therapy is that every therapist has their own therapy guide, like they're sort of their compass of what they do and how they approach things. But that also is challenging in the sense that not all therapists agree on the same approach to certain conditions. So that's why it's important to vet and have good conversations with your therapist about what your personal goals are, to make sure that they are willing to support you in their goals and not push their own clinical goals, if that makes sense. Just focusing on you as really the guide of the therapy.
Great, yeah. If you have questions for Marie, because she's got to blast off here real quick, please offer those questions right now. Looks like she disappeared already. Okay, well, go ahead. Questions, please, everyone.
I guess this really isn't, I mean, I don't have a question, but more so we love to collaborate with each other. So whether it be, collaborating with the assisted living where somebody's there for a respite, or, if you have non-medical home care coming in, we love to collaborate together. If somebody's working with, whether it be speech therapy, home health, a lot of times there's exercise programs that are put together that we all want to know, that's some of that training and sort of continuing, cohesive care, I think, that Marie was talking about. We do like to support one another and making sure that wherever you are, whoever you're working with, that everyone is on the same page. And so we do love to collaborate regardless of where you are in your journey here.
Yeah, absolutely. We're here to be resources. And I think we're very blessed in the Dane County area to have the amount of resources that we do. So, people come visit me, it's all about learning what their needs are. And it may not be assisted living. It may just be like, oh, this is what I thought I needed, but now I really need this. And I do find that there is still misinformation out there. There's a lot of good information, but there's misinformation too. And some of that just comes from the complexity of what all the different services can provide. And yet each service could be a little bit unique based on the company or who's running the organization, or a little different licensure, or so those are just things to be aware of. And I always say knowledge is power. So don't be afraid to just get out and attend these things like today, or reach out to individual locations, or talk to your Aging and Disability Resource Center, just to start getting some good information so that you're prepared. And maybe it's not something you need today. Maybe it's something you're going to need 2 years from now. But it's just good to know a little bit about what's available. Any other questions?
Any other questions? Come on, folks. Heidi's helped us with presentations in the past. She's really terrific. And Becky, I just met her today, but I mean, we know from, the advertising, Senior Helpers is really doing a great service for people trying to stay in their homes as long as possible. So.
Well, thank you. We certainly try. And I think too, to be very honest, sometimes there's different staffing concerns. Everybody hears about the caregiver shortages, and again, in trying to help people no matter what, if we're not going to be able, much like Heidi was saying, if we don't have the support available when you call, depending on what your schedule is, we're going to help you find, we're going to give you some other suggestions. We're going to try to get you pointed in the right direction, because if you take a step, you're reaching out, you obviously need some help, and we want to help you.
I'm going to speak real quick because I presented and I work with Heidi at Brookdale. Also, when you're looking at these services, I know it can be scary, and I've been in senior living long enough that you don't think it's needed, let's wait, let's hold on to our belongings, let's stay home, let's do all this, and which is important. We want to see you stay at home as long as you possibly can, but it's always just my last reminder to remember that it's better to have options, even to be on a waiting list somewhere. So you're getting to choose where you want to go. Too often do we see an injury happen, a fall, an illness, and then the person that's in the skilled nursing, for example, or rehab, doesn't really get to pick and choose where they want to go. And so knowing in advance that you're able to feel confident with where you're going, you have choices and options, I think is super, super important. And the nice thing about a respite stay is you get to actually experience what it's like at a place, or two, if you want to try a few different places. So just keep that in mind. It's just really important to not feel rushed with the process, because you want wherever you go to feel at home.
And Lisa, go ahead and jump in here.
Hi, everyone. I know some of you know me. I'm Lisa. I'm with the police department in Oak Creek. So we're a little outside of the Madison-Dane County area, but I have a question maybe for Amber. I know you just spoke, but I was thinking specifically, Heidi, about resources for people who are trying to encourage someone with dementia to make that switch, move into perhaps an assisted living center that has that continuum of care. I do deal with this in my job, but I'm also dealing with this on a personal level right now. My father is he keeps backing out. He wants to go in, then he doesn't want to go in. So just trying to encourage him. So any just, I guess, resources
I do think it's,
we have.
Yeah, I do think it's very individualized. But in your case, in particular with your father, where is he kind of at in his dementia journey?
Recently diagnosed, like clinically, but I would say about 2 years into some memory loss. And
Okay. So
And he-
still fairly independent in his thoughts, but just confused overall and maybe not processing as you would like him to, as it relates to making some good decisions for himself. Am I,
Yeah.
okay,
And
So
and
that's
there's my, in my situation, my mother is, they still live together, but she has some physical health issues. So we found a wonderful place that they can move into, and we've been trying to move forward, but then he keeps pulling back. He just did it again last night where he said no, he wasn't going to do it. So, and I know from just my own experience with my in-laws that as Amber was mentioning, that whole idea of if something happens, having to make a decision, at the last minute and maybe not getting any place where you really wanted to be, that's what we're trying to prevent.
Is mom on
Having-
board with the move?
My mom is on board with the move. She definitely does want to move.
So if mom moves, will dad stay home?
Well, he says he will. He did last night, but I don't think he would. I really don't think he would.
Yeah, I think sometimes it's that tough love, it's really hard, but I think if everyone collaborates and pushes forward, usually that person is like, will give in. They might stomp their feet a little bit. They might, and it's really just saying, this is what's best for all of us. And don't make it about him. Make it about mom. Mom's tired. Mom needs this. Mom can't stay here anymore. And she would really like you to be with her. And this is what she's asking you to do. Or use a physician. Dad, the physician says this is just getting to be too much for you to be. You have to kind of find those excuses and those people and make sure that sometimes take it off of him. Sometimes I think that person that's affected, they feel like it's because of them or because they can't do it anymore, or they're just so insistent they can still do it. And why do they need this? And why are you making them do this? So if there's an opportunity to take the ownership off of him and assign it to someone else, I think that can be really, really helpful.
That's great advice. And I mean, you mentioned before one of the arguments that I keep making with him is that the place that they're moving into is not a long-term, it's month to month. And I have told him that because I think he's so worried about getting locked into a commitment. So I have used that, and that's been able to persuade him from time to time. But that advice about the ownership is really, really very, I think that will be useful.
Yeah, and I think also just acting more quickly. I think the longer people perseverate or have time to think about things, sometimes it gets harder, not easier, especially with dementia. So, kind of saying, hey, this is the plan. We're doing it on this date. And maybe you don't tell them, 3 weeks in advance, you tell them a couple days.
Okay.
And, mom is moving, dad. So, she can't do this anymore.
Those are
having
great
real
advice.
having real conversations also based on the stage of the dementia. I hate to say this, but we have had where, oh, well, there's a leak in the house right now. We've got to repair the roof, for a while, get them into a community. Heidi, I see you smiling and being like,
well, I mean, it's, I think that would be later on. I think that would be a hard one.
it is, but I just want to give the option.
there
that,
are.
there
We
are
call them
little
little white lies to make life
Yep.
easier and less stressful.
And then they enjoy going in the community. They have visitors come in and visit with them. They get used to it. Sometimes then it's like, well, I don't want to go back home, once they're actually in there. But it's just those getting it to the point of, well, there's something going on. So they're not feeling it's about them, that there's something structurally with the house or the home that they need to go stay somewhere to then experience it, especially if it's a short-term respite. So that's just some, verbiage, and we've got some tip sheets on how to have those conversations with parents too. So if you're interested in receiving something like that, I'd be happy to get that over to you.
Yeah, I would love that. I mean, I can, I don't know whether you will share their contact information. But I mean, I can reach out to both of you. I'd love to, get any other, resources that you have.
Sounds good.
Thank you.
Anything else we can be helpful with today?
Okay, if there aren't any other questions, we've run over a little bit. Just want to thank Becky and Heidi. And Amber's on our triad committee, so she's always a great help setting up these sessions. So thank you, Amber. She's always very helpful in providing more information. So please get in touch with Amber if you need to. She's a great helper. Right, let's call it a day. Thank you, everyone.
Thanks to
Thank you.
everybody.
Thank you. Take care.